fluorides. I had told you about community water fluoridation in the previous video. Now, the second and important one is salt fluoridation. Salt fluoridation is the second type of systemic fluorides pioneered by Vespi in the year 1955 in the country Switzerland. In the country Switzerland, the dosage is 250 milligrams of fluoride per kg salt. Okay, per kg salt. There should be centralized production of salt in that country or a community wherever you plan to start. Okay, the salt fluoridation has a good K's reduction. K's reduction is in the range of around 50%. It has its own disadvantages. Salt has its own disadvantages. There are two major disadvantages. The two major disadvantages are children less than 4 years do not consume salt, hence not benefited of fluoride. Okay, then with respect to adults, patients with medically compromised conditions, salt consumption is very less, or in fact it is nil only. So salt consumption is almost nil. So they also don't get benefit from fluoride. So these are the two disadvantages of salt fluoridation. Next type of systemic fluoride that we have is called milk fluoridation. Number 3 is milk fluoridation. Okay, the milk fluoridation was pioneered by a person called Ziegler, again in the year 1955. The country is also same, Switzerland. Okay, the dose for milk fluoridation is 0.625 milligrams of fluoride per kg salt. Now, milk was used because milk is a very good vehicle for nutrients. So many nutrients are added in the milk as part of health programs. So they thought, why not add even fluoride also in that? Okay, that was the logic used in using milk. But milk creates the biggest disadvantages. Milk creates intersocial class barrier because the poor cannot afford milk every day. Creates intersocial class barrier as poor cannot afford every day. So please remember this. Okay. Caries reduction is also pretty good. Caries reduction is around 40 to 50%. Pretty decent. 40 to 50%. Okay. The next important systemic fluoride, very, very important, in fact, is number 4, fluoride supplements. Fluoride supplements. Now, fluoride supplements, there's a chart. You have to remember this particular chart because this chart will guide you to solve lots and lots of MCQs. Okay. So 4x4 table. The 4x4 table. Concentration less than 0.3 ppm, 0.3 to 0.6 ppm, or more than 0.6 ppm. 6 months, you should 6 months to 3 years. Please remember, supplements should start only after 6 months of the child's birth. Never start at birth. Supplements are never given at birth. Okay, it is wrongly given in some MCQs book that fluoride supplements have to start at birth. It's wrong. The minimum age is 3 years. Okay, 3 years to 6 years, 6 years to 16 years, and upper limit is 16 years. This many students have asked me this question, so I'm repeating once again. 6 months is the minimum, and maximum upper limit is 16 years. Beyond 16 years, you need not give supplements. Okay, so 0.25 milligrams, 0.5 milligrams, 1 milligram, dash 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 0.25 milligrams and 0.50 milligram. Remember this table very nicely. Caries reduction is in the range of 50%, very effective. 50 to 60% caries reduction is observed. Factors to be kept in mind, factors to be kept in mind for prescribing fluoride supplements. There are three factors as a dentist you should keep in mind before you prescribe fluoride supplements. The first is age of the child. The second is concentration of fluoride in water. And lastly, temperature or climatic conditions. Okay, now once you are done with fluoride supplements, the last type of systemic fluoride is school water fluoridation. Number 5, school water fluoridation. Now, school water fluoridation was done first in Virgin Islands in the year 1955 in USA. It is actually, some say it is 55, some say 57, but don't worry about it. Place they have asked as MCQ, which was the first place where they started school water fluoridation, and the place is Virgin Islands in USA. Okay, carry the concentration or the dosage is 4 to 5 ppm. Okay, and carries reduction is in the range of 25 to 35%. It is done. It is done in only those areas. Done in only those areas where there is no community water fluoridation. So at least the school children can be benefited. Now the next very important thing for you to know is defluoridation. Now, defluoridation, as you have heard, if the patient consumes high concentration of fluoride during the developmental stages of the teeth, it leads to a condition called fluorosis. Now, for the future generation, they should not develop fluorosis. So you want to remove excess amount of fluoride that is present in the water, and that technique is called as defluoridation. Okay. Now, to do defluoridation, there are two techniques. Okay. First is called as ion exchange. Okay, also called as adsorption. Now, with respect to adsorption, the example is carbion, defluoron, 1, 2, magnesia. Okay, not very important. We are not bothered about these ion exchange things. What we are bothered mainly right now is about addition of chemicals. That means you are adding some chemicals into the water so that the excess fluoride is taken down and the clear water stays back. So for this addition of chemicals, the technique that most important for us is Nalgonda technique. Now, Nalgonda technique was developed in the year 1974 at Nagpur. The institute name was Neri. Okay, Neri. The raw materials added were alum, lime, and bleaching powder. Okay, alum, lime, and bleaching powder. Now, alum was added because it will form the sediment. So it will take the heavier particle with fluoride and settle at the bottom. Lime was added to adjust pH, and bleaching powder was added as a disinfectant for disinfection. Now, as you all know, that bleaching powder is nothing but calcium chloride, chloride basically, and when chlorine is added, it basically acts as a disinfectant. Okay, so that is about defluoridation. Next we will move on to uh, topical fluorides. In the topical fluorides, again there are two types: professionally applied and self-applied. First, we will go with professionally applied topical fluorides. Professional topical fluorides. In that, the first one is sodium fluoride. Sodium fluoride. Now there are two scientists who have been given credit for it. Bibby in the year 1942 and even Knudsen, the same Knudsen who gave our DMFT index, Knudsen 1943. Okay, the pH is neutral 7. Okay, ppm is 9200 and we use 2% sodium fluoride. 2% means 20 grams of sodium fluoride in 1 liter of water. Okay, then technique of application. Technique of application, it is called as Knudsen's technique. Knudsen's technique. In Knudsen's technique for application of sodium fluoride, okay, 4 age groups were chosen. 4 age groups in the Knudsen's technique. 4 age groups were chosen: 3 years, 7 years, 11 years, and 13 years, corresponding to the important eruption dates for the teeth. Okay. Now, each in each year, the child was asked to come at 4 weekly intervals. These are 4 weekly intervals in each time. At the first week of each year, which I have marked round, the child used to undergo oral prophylaxis. Okay, so once the oral prophylaxis is done the first week or in subsequent weeks, the child will be applied sodium fluoride. Sodium fluoride is very technique sensitive. It is very technique sensitive. So sodium fluoride is applied for 15 seconds per tooth and allowed to dry for 4 minutes. Allowed to dry for 4 minutes. But if sodium fluoride applied for more than 15 seconds, calcium fluoride bridge is formed. Please remember, calcium fluoride, you want calcium fluoride to form. Whenever you apply any topical fluoride, eventually one of the end product is going to be calcium fluoride. You want this calcium fluoride to act as a reservoir of fluoride. But if you apply sodium fluoride for more than 15 seconds, instead of acting as a reservoir, it is going to act as a bridge. Now, once it starts acting as a bridge, it will further the penetration of fluoride into the tooth will not happen, leading to a phenomenon called as choking off phenomenon. Called as choking off phenomenon. Okay. Now, caries reduction with sodium fluoride is in the range of 30%. Caries reduction is in the range of 30%. Okay. Remember, this is asked choking off is due to improper application of sodium fluoride. Okay. Then the next important thing that we have, number 2, is stannous fluoride. Stannous fluoride. Okay. With respect to stannous fluoride, the pH is acidic. The pH is acidic. ppm is 19,300. It is used either as 8% or 10%. Okay. Now stannous fluoride needs to be freshly prepared. Needs to be freshly prepared because it forms a white cloudy layer of tin hydroxide. Tin hydroxide. Okay. So since it forms a white cloudy layer, the tin will not be tin, tin will not be enough. There's only fluoride will not be sufficient for prevention of caries. You also need stannous. Okay, so stannous will not be available. That is why you need to freshly prepare stannous fluoride. So for preparing 8% stannous fluoride, 0.8 grams of stannous fluoride is dissolved in 10 ml of water. Okay. Now, mechanism of action. And technique of application. Technique of application. Now, with respect to mechanism of action, remember it is biannual or annual maximum based on the caries risk, biannually applied. Okay, so when stannous fluoride is applied, 4 end products are formed. 4 end products are formed. Number 1, tin hydroxy phosphate. Okay. Then number 2, tin trifluorophosphate. Number 3, calcium trifluorostannate, and 4, calcium fluoride. Now, with respect to tin hydroxyphosphate, it is responsible for causing metallic taste in the oral cavity, and tin trifluorophosphate and calcium trifluorostannate are responsible for anti-caries effect. Okay, stannous is caries reduction is pretty good. Caries reduction is up to 35%. 35%. It has its disadvantages, which in fact are lots of them. Disadvantages are, number 1, needs to be freshly prepared before application. Every single time you want to use stannous fluoride, you need to freshly prepare it. Then it has metallic taste because of tin hydroxyphosphate. Okay. Then it causes pigmentation. Of teeth. It also causes burning sensation of gingiva. Then next we have got is APF. Number 3, acidulated phosphate fluoride. Okay, acidulated phosphate fluoride. This was given by Brudewold. Now it has got APF solution. The pH is 2 to 3. APF gel is also there, as you all are very well aware of. The pH for that is 4 to 5. Okay. ppm is the same. ppm is 12,300. Now APF is equal to 1.23% sodium fluoride or 1.23% fluoride. It is one and the same. Okay. Now, how do you prepare it? 20 grams of sodium fluoride in 1 liter of 0.1 m phosphoric acid. To this, 50% hydrofluoric acid is added. Hydrofluoric acid added. Okay. Now again, technique of application. It is applied continuously for 4 minutes, annual or biannual application, means once in an annum or twice maximum. Okay. Then mechanism of action. When APF is applied, it initially leads to hydrolysis and shrinkage of hydroxyapatite crystals. Okay, hydroxyapatite crystals. This leads to formation of an intermediate product called as dicalcium phosphate dihydrate, DCPD. This DCPD is highly reactive to fluoride. This DCPD is highly reactive to fluoride, eventually forming fluor hydroxyapatite plus calcium fluoride, fluor hydroxyapatite and calcium fluoride. Now, the advantage of gel over solution is patient can use at home without professional help. So self-application is possible with the help of gel if you train the patient. Okay, this is about APF. The next one we have is fluoride varnish. Fluoride varnishes. Okay, it was introduced by Schmidt in the year 1964 in Germany. Basically, these fluoride varnishes, they stick to teeth for a longer time. Okay, they set when in contact with saliva. Okay, there are lots of fluoride varnishes, but two which are there at UG level are Durafut and Fluor Protector. Durafut is 2.26% fluoride in an organic lacquer. Okay, this contains 22,600 ppm of fluoride, very high concentration. Okay, the second one is Fluor Protector. It is 0.7% of fluoride in a polyurethane lacquer. Basically, polyurethane means it's a resin based. Okay, and it contains 7,000 ppm of fluoride. Okay, so of the two, of course, Durafut is a better one. Caries reduction is also very good. Caries reduction is in the range of around 50%. So caries reduction is very good with Durafut. Now these are the four types of professionally applied topical fluoride. Next we move on to self-applied topical fluoride. Okay, in that we have dentifrices and mouth rinses. So first we have got fluoride dentifrices. So first we have got is fluoride dentifrices. Now, the first fluoride dentifrices, they're launched in the year 1956. Okay, they were launched in 1956. Fluoride dentifrices, the first marketed was in the year 1956. The name was Crest, contained stannous fluoride, approved by FDA 1956 and approved by ADA in 1964. Okay, fluoride concentration in dentifrices is 1000 ppm. 1000 ppm. All these are individual MCQs. Okay, 1 gram of toothpaste contains 1 ppm of fluoride. Okay, caries reduction is in the range of 25 to 35%. The current regimen that we are following, the current regimen that is being followed is from 6 months, because the first teeth to erect in the oral cavity is 6 months. From 6 months to 3 years, the child is supposed to use rice grain size, rice grain size, or a smear of fluoride toothpaste. Fluoride toothpaste. Okay. Then from 3 years to 6 years, the child is supposed to use pea size. Of course, above 6 years is, we are all above 6 years. We can use above 6 years. Okay, twice daily, half to two-third of bristle length. Okay, so this is about fluoride dentifrices. The next is fluoride mouth rinse, number 2. Self-applied, number 2 is fluoride mouth rinses. Now there are two types of fluoride mouth rinses, daily and weekly. Daily and weekly. Daily is 0.05% sodium fluoride. Okay, 0.05. Weekly is 0.2% sodium fluoride. This contains 225 ppm and weekly contains 900. Okay, there are certain rules of carries this fluoride mouth rinse. Okay, mouth rinses are not recommended for children less than 6 years because swallowing reflex is not developed. No swallowing reflex they don't have. So what they'll do is they'll accidentally consume it. So chances of fluoride, acute fluoride toxicity increases. 10 ml is used. 10 ml is used. Okay, and technique used is swish and spit technique. Swish and spit technique. Okay, sodium fluoride is most commonly used raw agent. Most commonly used raw agent. Okay, the mouth rinse should be colorless, flavorless, and odorless. Okay, caries reduction is same as your dentifrices, 25 to 35%. Now coming to the last thing about fluoride is acute fluoride toxicity. Acute fluoride toxicity, you have something called as safety tolerated dose, called as STD, that is 8 to 16 milligrams of fluoride per kg body weight. Then certain lethal dose, that is called as CLD, that is 32 to 4 milligrams of fluoride per kg body weight. Okay. Now, if the child consumes less than treatment of acute fluoride toxicity, if the child consumes less than 5 milligrams of fluoride per kg body weight, administer calcium orally. The child has consumed, this is first one, the child has consumed 5 to 15 milligrams of fluoride per kg body weight. First, induce vomiting, and then administer calcium orally. Okay, if the child has consumed more than 15 milligrams of fluoride per kg, then immediately admission to the hospital. Then induce vomiting, and then administer calcium through IV lines because the patient is going to be unconscious. Then monitor urine output, urine output. Last but not the least, start management of shock therapy. Okay, so there is one last thing. Remember, 5 grams is certain lethal dose. 5 grams is certain lethal dose. On top, I've given you 32 to 64, isn't it? So 32 to 64 milligrams of fluoride per kg. Now 5 grams will come is 64 into a 70 kgs. That will become approximately 4.5 grams. That's how you get this 5 grams. So this also has been asked as MCQ. Okay, so 5 grams is certain lethal dose. Okay, so 64 is taken. An average adult will weigh 70 kg. So 64 into 70 becomes 4.5 grams, rounding off to 5 grams. So that completes the video LMRT for you. Okay, so all the very best, my dear students. Do well for your future, and may God bless you to get the desired seed that you want. Okay, study hard, stay home, stay safe. Thank you all.